Can you get hip pain from stretching? The answer to that is yes, you actually can get hip pain from stretching. Now, a lot of people think that stretching is good for preventing injuries and recovering from injuries, and sometimes it is. But as with most things, there's a happy medium. You don't want to be too stiff, but you also don't want to be too flexible. And actually, given the choice between the two, I'd rather choose to be a little bit on the stiff side rather than being too flexible. Because people who have too much flexibility actually do tend to get hurt a little bit more. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain 3 different ways that you can actually get hip pain from stretching and how to avoid that so you can be as flexible as you need to be for your activities and avoid getting hip pain. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people to stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So, what are the conditions where you can get hip pain from stretching? Well, largely those happen in people who probably really don't need to be stretching in the first place. There are certain conditions that make people just genetically a little bit more hypermobile or hyperflexible. That means that your joints and your ligaments just are a little bit more stretchy. They're not as stiff as the average person's. A lot of times there is a congenital link to that. For example, Ehlers-Danlos syndrome is one condition where people may be a little bit hypermobile or hyperflexible. Now, people who are hyperflexible do tend to gravitate towards sports like dancing or gymnastics or cheerleading or even martial arts. In those sports, it benefits you and it gives you a competitive advantage to be extremely flexible. But that doesn't always come without cost. And sometimes that cost means you end up getting injured more because your joints aren't necessarily supposed to go to those extreme ranges of motion. Now, does that mean that you can't or shouldn't participate in those sports? No, you just have to be a little bit smarter about how you stretch. So, one really common instance where people can get hip pain from stretching is when they do a splits or a hip flexor stretch where their leg is coming back behind them. And particularly when one leg is going backwards and the other leg is going forwards. So you go into more of like a lunge position or especially doing a front splits position. When one leg is going behind you like that, when your hip goes excessively behind you, the ball of this ball and socket joint right here actually starts to glide forward in the socket. And it can press into the labrum, which is a rim of cartilage that kind of lines and deepens the hip socket. It can also start to glide forward into your hip flexor tendons, which are your iliacus and your psoas. Together they make up a muscle called the iliopsoas, and that tendon runs right in front of the hip. So if you're going into extreme ranges of hip extension when you're doing a splits and the ball of your hip starts to glide forward in the socket, then it can bump into that labrum or that iliopsoas tendon and start to give you pain in the front of your hip. Now, what do you do if you get hip pain from stretching and it happens to be in your groin or in the front of your hip? Well, largely you want to improve the flexibility in the back of your hip. Now, if you don't need to go into those extreme ranges of motion, say you're not a dancer, you don't need to do the splits, you're not a gymnast, then just don't stretch that far. Stop at the point where you feel like the stretch is limiting you, where you feel a good stretch, but it's not painful. Don't push to extremes. But if you have to push to extremes for your sport, then it's all about balance, about getting the back of your hip equally as flexible as the front. So if the back part of your hip joint is a little bit stiffer, then when you stretch and go backwards like this, your ball has nowhere to go but to glide forward. So in order to loosen up the back part of your hip, a really good stretch or exercise for people who tend to get front of the hip pain when they're stretching is just going in the opposite direction. Doing an all fours stretch where you're on hands and knees and your body weight's kind of going down through your thigh, and then you're just rocking backwards, kind of like the child's pose or the prayer stretch, as some people call it. And that uses your body weight to help push your hip joint backwards in the socket and help get that back part of the hip equally flexible as the front part. Now, if you have hypermobility, the back part of your hip probably isn't stiff per se, but there's a lack of balance, that the front part is more hyperflexible than the back part. And so your body's going to follow the path of least resistance, and the ball of the hip will glide forward and start giving you that front of hip pain. Now, it's also important to develop the hip rotator muscles, which largely run back through this area from your sacrum back here over to your hip. They're kind of like the rotator cuff muscles of your hip. They help hold the ball securely in the socket and don't let it glide too far forwards when you're doing different activities. Now, I've got other videos that show strengthening exercises for the hip rotator muscles, such as the clamshell exercise is one really common one. But you also want to be able to balance your body over one leg, particularly if you're involved in sports like dancing and doing high kicks, or gymnastics where maybe you're balancing on a balance beam with one leg while putting your other leg in some extreme position. So it's really important to be able to develop the functional stability by doing single leg activities, balancing on one leg, doing single leg squats, and doing other single leg work that you'll probably get into those positions doing sports like gymnastics or cheerleading anyway. So that's the first cause of hip pain from stretching. Now, the second cause of hip pain from stretching comes from a similar movement, doing a hip flexor stretch or a lunge to extremes, or doing a front splits where you're putting one leg backwards and one leg forwards. But instead of actually being at the hip joint, it can happen at the sacroiliac joints back here. And that's where the hip bones kind of join with the spine. There's little joints right here that move back and forth. And if one joint is going forwards while the other joint is coming backwards, that can create a shearing at this joint right here, and you can get pain in the back of your hip. Now, the way that you correct that, if you get that pain in the back of your hip, is just to do the opposite of the motion that caused it. So if you're doing a stretch with, say, one leg forwards and the opposite leg backwards, and you start feeling a pain in the back of your hip after doing that type of stretch, then going the opposite direction and stretching the opposite way. So if this leg was backwards when you got injured, bringing that leg forwards and the other leg back helps rotate those sacroiliac joints or SI joints back in the opposite direction. And I've got another video on how to correct an SI joint dysfunction that I'll also link to for a little bit more detail on how to self-correct that type of problem. Now, the third type of hip pain that you might get from stretching actually isn't really a hip problem at all. It's when you're stretching your hamstring too far, or someone else is stretching your hamstring too far, and you raise your leg too far up doing a hamstring stretch. That puts tension on your sciatic nerve. And if you start stretching too far, especially if your muscles are a little bit more hyperflexible to begin with, they may not limit you at the point where your sciatic nerve should normally stop. And that can actually pull on the nerve roots in your back, or where the sciatic nerve runs under your piriformis here in your hip. And it can create symptoms of sciatica, which will give you the feeling of pain in your buttock or in the back of your hip after you stretch to extreme. Now, again, using the rule of thumb of following comfort and stopping when you start to experience pain when you're stretching, only stretching to a comfortable position, is a good rule of thumb. I've actually had a patient or two who they've been to physical therapy and the therapist stretched them a little bit past their comfort level, and they actually ended up developing sciatica as a result. Now, if you are having therapy somewhere, it is important to let your therapist know what you're feeling, because they may or may not know what you're feeling. So it is important to give them feedback and let them know when to stop if you are experiencing pain. Now, I will say that typically when you get overstretched in a therapy situation, it's usually a younger physical therapist who isn't as experienced and doesn't necessarily have the feel to know for when your muscles have reached their end point. So it is important to have a good experienced therapist who can kind of read your body language and also feel when your tissues are at their end points, especially if you've dealt with some sort of prior hip pain from stretching. Now, if you are watching this and you've had some hip pain or maybe even been injured in therapy and you happen to be in the St. Louis area, we'd be happy to help you out here at More for Life. Just contact us through our website and we'll get you in for an appointment, help you figure out what's causing your hip pain and what you can do to get it better. And if you're watching this video from somewhere else, but it helped you get a little bit more clarity about why you may be experiencing hip pain after stretching, then give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.